What is coronavirus? And why we should know about it. Novel coronavirus of 2019. In December 2019, a pneumonia outbreak was reported in Wuhan, China. On December 31, 2019, the outbreak was traced to a novel strain of coronavirus, which was given the interim name 2019 MERS-CoV by the World Health Organization, WHO. Some researchers have suggested that the Huanan Seafood Market may not be the original source of viral transmission to humans. Let's get the information about the coronavirus. The novel coronavirus is called novel because it is new. It was first reported in December 2019 in Wuhan City in China. The name coronavirus is derived from the Latin corona, meaning crown or halo, which refers to the characteristic appearance of the virus particles, which is virions. They have a fringe reminiscent of a crown or of a solar corona. A novel coronavirus, MERS-CoV, is a new strain that has not been previously identified in humans. Coronaviruses, CoV, are a large family of viruses that cause illness ranging from the common cold to more severe diseases such as Middle East Respiratory Syndrome, MERS-CoV, and Severe Acute Respiratory Syndrome, SARS-CoV. Coronaviruses are zoonotic, meaning they are transmitted between animals and people. Virology. Coronaviruses are in the subfamily Orthocoronavirinae in the family Coronaviridae, in the order Nidovirales. They are enveloped viruses with a positive sense single-stranded RNA genome and a nucleocapsid of helical symmetry. The genome size of coronaviruses ranges from approximately 26 to 32 kilobases, the largest for an RNA virus. What is its history? Coronaviruses were discovered in the 1960s. The earliest ones discovered were infectious bronchitis virus and chickens, and two viruses from the nasal cavities of human patients with a common cold that were subsequently named human coronavirus 229E and human coronavirus OC43. Other members of this family have since been identified, including SARS coronavirus in 2003, CoV-L63 in 2004, HKU1 in 2005, MERS-CoV in 2012, and 2019 and CoV in 2019. Most of these have been involved in serious respiratory tract infections. How it is transmitted. These viruses are called zoonoses, because they are transmitted from animals to humans. SARS virus was found to be transmitted from civet cats to humans, but the original habitat of the virus was probably bats. It could also transmit from human to human, making it contagious and dangerous. The world's most trafficked mammal may be involved in the Wuhan outbreak, but the evidence is far from clear. It is also far from clear whether the pangolin is the animal that passed the new virus to humans. Bats are still thought to be the original host of the virus. If pangolins are involved in disease transmission, they would act as an intermediate host. There is evidence that the virus spreads from person to person. Respiratory coronaviruses probably spread in a fashion similar to that of rhinoviruses, via direct contact with infected secretions or large aerosol droplets. The virus is most likely spread through close contact with an infectious person, contact with droplets from an infected person's cough or sneeze, touching objects or surfaces, like doorknobs or tables, that have cough or sneeze droplets from an infected person, and then touching your mouth or face. What are the symptoms? Common signs of infection include respiratory symptoms, fever, cough, shortness of breath and breathing difficulties. In more severe cases, infection can cause pneumonia, severe acute respiratory syndrome, kidney failure and even death. How can we diagnose the infection? If you become unwell and think you may have symptoms of coronavirus, seek medical attention. Call ahead of time to book an appointment. Tell your doctor about your symptoms, travel history and any recent close contact with someone who has coronavirus. If you must leave home to see your doctor, wear a surgical mask, if you have one, to protect others. Until recently, no sensitive, rapid method existed to detect all of the known human coronavirus strains. Rapid techniques that can be used to detect coronaviruses from nasopharyngeal samples include reverse transcriptase polymerase chain reaction, RT-PCR, and immunofluorescence antigen detection assays. What is its treatments? There is no treatment for coronavirus, but medical care can treat most of the symptoms. Antibiotics do not work on viruses. If you have been diagnosed with coronavirus, isolate yourself in your home. You treat a coronavirus infection the same way you treat a cold. Get plenty of rest. Drink fluids. Take over-the-counter medicine for a sore throat and fever. But don't give aspirin to children or teens younger than 19. Use ibuprofen or acetaminophen instead. A humidifier or steamy shower can also help ease a sore and scratchy throat. Current facts on coronavirus. There is no cure for the common cold. A coronavirus causes both severe acute respiratory syndrome and Middle East Respiratory Syndrome related coronavirus. Coronaviruses infect many different species. There are 7 known human coronaviruses. SARS spread from China to cause infection in 37 countries, killing 774 people. How can we prevent the spread? Standard recommendations to prevent infection spread include regular hand washing, covering mouth and nose when coughing and sneezing, thoroughly cooking meat and eggs. Avoid close contact with anyone showing symptoms of respiratory illness such as coughing and sneezing.